Good afternoon, everybody. This is Dr. Adam Rinne, naturopathic physician from Sound Integrative Health in Bellevue, Washington, soundintegrative.com. I'm speaking with you today a little bit about bone health. This is an important topic. As our aging population gets over 65, there is a significant percentage of people that will be dealing with osteoporosis. This is so important because one of the leading causes of mortality is fracture to a major bone such as a hip or femur. And so anything we can do to preserve bone health and prevent fracture is really important from a preventative medicine standpoint. I had the opportunity of interviewing an expert, Dr. John Newstead, on this topic on my website, The One Thing Podcast with Dr. Adam Rinne. You can find that episode by searching in iTunes or Spotify or one of the other major players. I have been getting into this research recently, also in my area of clinical interest, because many people with inflammatory bowel diseases are going to be dealing with bone density issues as they get older. Not only is there a malabsorption issue with nutrients, but also the use of steroids can lead to bone density issues. So we really have to focus on this for a number of reasons. So someone with Crohn's or colitis really needs to be thinking about bone health and being proactive as they endure IBD. And so I've been getting into this research. I wrote an article that's on my website, soundintegrative.com, that talks about some background on bone density and bone modeling, bone remodeling, and testing. And you can see that on my website, on my blog, soundintegrative.com. I'm currently doing some research on treatments and just updating my knowledge on treatments. Everybody knows about the basics, calcium, vitamin D, but there's more out there, and we really need to get clear about what's the best targeted approaches to helping with bone density. So I came across a great part of an article from Dr. Jennifer Higgs and her group in 2017. Wrote a really good review on nutrition and osteoporosis. One of the highlights for me was learning about the impact on prunes and bone health. I'm a big fan of food for medicine. Anything that's not a pill or powder or liquid syrup kind of tasting medicine and it comes from diet, I'm all for. But the issue with that is usually when people say food is medicine, they don't realize that there actually has to be a specific dosage of each food to actually have a therapeutic effect. Now, if you have no real health conditions, eating kind of generally a health promoting diet can certainly obviously prevent disease. But when people are talking about food as medicine, can you actually eat the amount of food? Is it really practical to lead to the specific outcome? Well, with prunes, I found some research that indicates that that's the case. Prunes provide a significant amount of vitamin K, manganese, boron, copper, and potassium. These are all very good nutrients that support bone modeling and bone health. A lot of people think about just calcium and getting calcium in the diet, which is very important, but there's other aspects. There's a whole recipe of nutrients that make up good bones, and prunes provide many of those key nutrients that are involved with bone health. Also highlighted is that the mechanism of prunes action is proposed to be suppression of rankle, which is a therapeutic target of many osteoporosis medications that are in development, some that are actually out there. Rankle is involved with regulating osteoclastic activity and bone breakdown. Prunes seem to have an impact on slowing osteoclastic activity and also promoting some osteoblastic growth. So that's the thought, the mechanism that's thought to be attributed to prunes. So how many prunes do you need to eat? Well, there was 2 studies that were highlighted, and most of the studies indicated 4 to 10 prunes per day was the therapeutic amount. That's 50 grams to 100 grams of prunes a day. And in 2 separate studies compared to controls, there were improved bone density outcomes. The first study that was highlighted, there was improvement in the ulnar and spine bone mass density. And then in the second group, which was an osteoporosis population of 48 women, ages 65 to 79, 6 months of consuming 50 grams of prunes or 100 grams of prunes per day increased total bone mass density compared to controls. Now, this is a very practical thing to, perhaps maybe not every day, but most days kind of rotate these into your diet. And a lot of people are probably thinking, can I digest prunes? Well, I mean, they've been used for years and years for constipation. So if you have constipation issues, they might help with that as well. They're potentially for someone who has like SIBO or other issues like upper GI issues that are involved bloating, they might contribute some to bloating. So you have to kind of be careful and test them out. But if you're generally doing okay digestively, or if you don't have problems with digesting prunes, what a wonderful thing you can incorporate in your diet to preserve some bone mass, maybe increase your bone density. And it's not a pill, potion, drug, supplement, simple. So I hope you enjoyed this, and we'll talk to you down the road. Thanks.